there was a study that came out recently that I reported on myself, and it found that Black Americans had experienced an excess of 1.6 million deaths compared to their white counterparts during the past 2 decades, and that there'd been a period of progress, and then things plateaued, and then the pandemic ballooned things and just made the crisis, right, like exponentially worse. And so we'll get to the drivers in a minute. But what I want to ask you is, what is going on here? Why does it seem like we're going in the wrong direction, Dr. Betancourt?
Yeah, it's a great question, and it's a sad reality, I guess, is what I'd say. The issue of health equity and health disparities, quite frankly, are built into our nation's history and our national fabric. We have, since our inception, had a segregated healthcare system. It's obviously gotten better over time, particularly in the 60s with the Hill-Burton Act and integration of hospitals. But ultimately, what we understand is that different communities have benefited at different rates from our investments in health, our investments in healthcare, our investments in technology. And this is an issue that is profound, it is persistent. And as you mentioned, I've been doing this work for the better part of 25 years. I'm a primary care doctor. I've been involved in health equity from the public health standpoint, from the policy standpoint, and we were making progress, slow but steady. I think with some seminal moments, I'd say one being the release of Unequal Treatment, an Institute of Medicine report in 2002, that I really believe in an evidence-based way sounded a national alert in ways that other people previously hadn't heard it, about how these disparities weren't just about the social drivers, but also about the care that people receive. I think we were making progress over the last 20 years. Healthcare expansion, healthcare coverage expansion allowed us to chip away as well. But as you said, the pandemic really set us back. We knew it was going to happen, given all the factors related to the pandemic. We knew that certainly man-made and natural disasters disproportionately impact vulnerable communities. And if you had a chronic condition and you were infected by COVID, you were going to do less well. And that really defined many of our communities across the country.